The fourth and the final part of therapeutic lifestyle in diabetes management is your stress management. Stress is a part and parcel of our daily life. Stress induces diabetes in our population, and also stress makes the diabetes difficult to manage. By stress we mean anxiety, depression. So to avoid stress, all the diabetic patients should go for relaxing exercises like deep breathing, yoga and exercises. The stress part of diabetes also increases the chances of being dementic and also a cognitive impairment in the diabetic patients. To avoid stress, the sleep is an important factor. The sleep has to be at least 6 to 7 hours a day, and lack of sleep also makes diabetes mellitus difficult to manage. So your sleep pattern should be regular and it should be up to 6 to 7 hours per day. And also you have to walk, jog, swim or do isometric exercises at least 30 minutes per day for 5 days in a week, which comes around 150 minutes in a week. This is very much important for your diabetic patients. And also you can split your walking time into 10 minutes 3 times a day, and whichever time which allows you, it is in the morning or in the afternoon or in the evening or even during night. So walking and good sleep management helps to manage your diabetes. The third part of our talk includes nutrients and diabetes. The nutrients we mean the carbohydrates, the proteins and the fats. As I told you earlier, we Indians are consuming more than 80 to 90% of carbohydrates in our food. The carbohydrate we mean the starch. The starch comes from all food which contains lot of மாவு பொருள் என்று சொல்லக்கூடியவைகள் எல்லாம் starch. So the starch which we consume raises the blood sugar immediately. So it is better we switch our carbohydrates to grains, fruits, vegetables, milk products. So the amount of carbohydrates in a food helps to control your blood glucose. Choosing carbohydrates from healthy sources like fruits and whole grains must be preferred over carbs from sources like added sugars, fat and salt. Proteins we have to go for lean proteins which have a very good satiating effect. It is better we avoid the organ meat which has lot of high quality protein and fat which is not good for diabetic patients. Then we come to the third part, that is fat. The fats are necessary part of balanced diet, especially healthy fats from fatty fish, nuts and seeds are advisable in a diabetic patients. They do not raise blood glucose but they're high in calories, but they can cause weight gain. But fats are necessary for diabetic patients as they help in brain formation and as they help in stopping the brain cells degeneration and prevents dementia, cognitive dysfunction and Alzheimer's in diabetic patients. Today we are going to the second topic on lifestyle modification, that is dietary modification in diabetes. First of all, we should learn to eat healthy. This is crucial when you have diabetes because what you eat affects your blood sugar. No foods are strictly off limits. Focus on eating only as much your body needs and when you are hungry. Get plenty of vegetables, fruits and whole grains. Choose non-fat dairy and lean meats. By lean meats, we mean red meat, and you have to avoid the organ meat. Limit foods that are high in blood sugar and fat, because if you take food which is high in blood sugar, in sugar, it will immediately raise your blood sugar and the control becomes very difficult. Remember that carbohydrates turn into sugar, so watch your carb intake. Most of the Indians take around 80 to 90% of carbohydrates in their one day food intake. It is more important that we have to limit the carbohydrates to 50 to 60% per day. The choice of food and the quantity to be eaten is relative to blood sugar levels. Eating more increases your blood sugar and managing diabetes becomes difficult.